Hi guys, what's up? This is Dr Alasa Mohammed. You're welcome to our online clinic. If you're just joining us, try to subscribe. Then after subscribing, try to click on the notification bell so you get a notification anytime we drop a new video. Now, today we'll be talking about how you can calculate your ovulation period. Well, this video is especially for women because the reason to calculate your ovulation period are just for two reasons. First is either to conceive a child or two to avoid pregnancy. So you calculate ovulation period to know the ovulation date, either for you to be able to get a child or to prevent pregnancy. So I'll be talking on both how you can calculate to get a child and you can calculate to also prevent pregnancy. Now let's get started. Now, ovulation simply means the release of a matured egg from the ovum to the fallopian tube, waiting for a sperm to fertilize it. Then if the sperm fertilizes the egg, then automatically pregnancy happens. But if the sperm doesn't fertilize the egg, then the ruptured egg comes out at menstruation. Now, for you to be able to calculate your ovulation period, first there are some rules you must go through. Now, you don't just use this method for just the first month. No, you must first study your menstrual cycle for at least 3 months to make sure and to know the kind of cycle you are having. Now, there's some women that are having a normal 28-day cycle. There's a woman that are having 29-day cycle. There's a woman that are having 30-day cycle. While there's a woman that their cycle is always fluctuating. So for such women, it's very difficult for them to get their ovulation period. Now, to calculate your ovulation period, there are different methods you can use. You can always use the mucor method, in which when you're in the ovulation period, your mucor in your vagina is meant to be more, you have more mucor and thick mucor, so you can use that in calculating your ovulation period. You can use the calendar method, which I'll be talking about today. I'll be telling you about the calendar method that you can use it in calculating your ovulation period. Then you can also use the normal ovulation kit in calculating your ovulation period. Now, for women that are having that their menstrual cycle, it's always fluctuating, it will be best for them to get the ovulation kit in calculating your ovulation period. Now, going into this topic fully, I told you that if you want to calculate your ovulation period, you must at least study your menstrual cycle for at least 3 months to know the kind of cycle you're having. Now, there's a woman that are always scared or always feeling sad because they are not having the normal 28-day cycle. If you're not having the normal 28-day cycle, there's no problem. I will teach you how to calculate it, even you're having 29-day, 30-day. All that matters is for you to have a constant cycle, meaning that if you're having a 38-day cycle last month, you should also have it this month, also have it next month, so you can always predict your ovulation period. Now, let's go. For people that are having a 28-day cycle, your ovulation period is always on the 14th day, because always split into two halves. 14 plus 14 makes 28. Now, even any person that's having 29 or 30-day cycle, your ovulation period is always the half of the cycle. That if you're having 28-day cycle, that is on the 14th day. If you're having 29-day cycle, that should be on the 14th to 15th day. If you're having a 30-day cycle, that should be on the 15th day. If you're having a 31-day cycle, that should be on the 15th to 16th day. Now, the way you calculate ovulation period is very simple. Once you start menstruating, you start seeing blood today, that is the day 1 of your cycle. Then for some women, the ovulation, the menstrual blood lasts for 4, some women last 5, some women last for 6 days. It varies. It's normal. The women last 3 days. It's normal. Now, for the first 4 days, that is for your ovulation, the first 4 days, you count your menstrual cycle. After the 4th day, the 5th day, when the blood stops, that is the 5th day of your cycle. Now, for some women, so for people that will want to calculate the ovulation period, not to have safe sex, in which they don't want pregnancy. Now, after your menstrual cycle, from the 5th day, you can start having sex, unprotected sex, because there is a very, very low chance for you to conceive in that period, because your egg is not yet matured, it's still growing. Now, on the 6th day, you can also have sex. On the 7th day, you can also have sex. unprotected sex, and you have more assurance that you might not get pregnant using without a protection. Then on the 8th day you can also have sex. Then on the 9th day, now on the 9th day, then your egg in your ovum is almost getting matured, but you can also have sex, unprotected sex, until the 11th day. On the 11th day, I will advise you, the 11th day of your cycle, I will advise you to either use protection or stay away from sex, because since I told you that the ovulation, the eggs drop on the 14th day, so you must stay away from sex at least 2 days before the ovulation period and 2 days after the ovulation period. So that's for people that don't want to consider, they don't want pregnancy. Staying away from sex 2 days before would keep you on a safer note, because your egg might drop a day before or it might drop 2 days after. Even if your egg drop on the 14th day, if the nature of the sperm is the sperm can survive in the woman's body for 2 days. So if you say, let's say you have sex on the 11th day, the sperm can survive in your body 11th, 12th, and the 13th day the sperm can still be alive. Then once your egg is dropping, the sperm fertilizes the egg, then you are pregnant. You get. But for a person, a woman that don't want to get pregnant, I would advise that on the 11th day, you stop any sexual intercourse or use protection while having sex. But for a person, a woman that want to have pregnancy and she's having a normal 28-day cycle, now on the 11th day, I will advise you to start having more sexual intercourse with your partner. 11th, 12th, 13th, 14th day, I would advise you to have more sexual intercourse with your partner, because it is assumed that by then the egg has already dropped in the fallopian tube, waiting for the sperm to fertilize it. Now, same, because the egg in the woman's body will stay up to 48 hours. So same on the 14th day of your cycle, 15th and 16th, I would advise you to continue having sexual intercourse since you are in for pregnancy, you want pregnancy. Now, for a patient or a woman that doesn't want pregnancy, now on the 17th or 18th day, you can start having sexual intercourse, because if you're having a 28-day cycle, on the 18th day, you can start having sexual intercourse, because by then the egg has ruptured, because there's no sperm to fertilize it. Now, for a person that's having a 30-day cycle, on the 15th day, that's likely to be your ovulation period. Then on the 15th, 16th, 17th, you can still start having sex if you want pregnancy. But if you're a woman that's having a 30-day cycle and you don't want pregnancy, then you should stay from sex from till on the 17th day. Then from the 18th day, you can start having sexual intercourse up till the 28th or 30th day before your blood comes out as menstrual flow. I think this will help you in calculating your ovulation period. I hope this video has helped you. Then try to subscribe to our online clinic. And you can also follow us on Instagram at Dr_Alasa, that is Dr. Alasa. And if you have any question below, just try to drop it on the link, then I will just drop it on the comment section, and I will give you a reply. And you can also send a direct message to me on Instagram at Dr_Alasa. Yeah, thank you very much, and God bless you.